understanding the trade-off actually help individual citizens?
Policy corrections that the government might have about these kind of long-term changes in operations.
And actually, when I talk about leadership, this is
So, without further ado, please allow us to now introduce the chair for this session, Professor Yik-Ying Teo, who is the Dean of the School of Public Health at the National University of Singapore. He's an eminent expert in this field and has also led many research initiatives in the region. So please join us in warmly welcoming Professor Yik-Ying.
Right, good morning, everyone. So thank you for joining us this morning. I know there have been a series of very high-quality site meetings that you could have gone to, but you chose this one. So hopefully we won't disappoint. And I thought it's very useful to start off by really highlighting that as part of the PMAC, we've always been looking at what are the mega trends in the world that have been affecting global public health. And some of the mega trends have already happened in our lives. For example, looking at globalization, movement of people across countries, not just across countries, but even urbanizations and the creation of mega cities where people are moving from rural parts of the world to more urban cities. This has led to the issue of demographic changes, where aging is a problem that is facing many countries, not just developed economies, but also low and middle income countries as well. Technology has clearly made a big difference in our lives. For any of you who have not yet heard about ChatGPT, strongly encourage you to just Google it after this exciting session. And then right now, we face a big mega trend around geopolitics. And I believe geopolitics will be the theme of next year's PMAC as well. So with this mega trends really comes the increasing likelihood of a number of health crises. Of course, we have already seen and experienced our own health crisis in the form of COVID-19 that has pretty much plagued our lives for the past 3 years. But it's not just pandemics that have been one of the crises that the world is faced with. All along, we have problems like antimicrobial resistance, we have the rising prevalence of non-communicable diseases. This have all been affecting the lives of not just individuals, but entire communities and populations. And I'm not even talking about the rising prevalence of mental health issues around the world. Now, when we start to look at some of these mega trends affecting the likelihood of the rise of crisis, which is really what this site meetings is about, looking at the future, current and future crisis, and really what are the solutions that we can bring to bear to tackle some of this crisis that we have. And that's where modeling has interestingly emerged as one of the technical skill set that has helped to advance a lot of the policy decisions and even communications to the public in terms of how do we look at the COVID-19 wave that is happening in different parts of the world right now. Governments, policymakers have been advised by modelers such as Professor Gabriel Leong, such as Professor Alex Cook, on how to make use of data to change their perception of COVID-19. But it's really not just in pandemic preparedness, because when I start to look at why is modeling important or even powerful, I can think of 4 possible reasons. The first, it's really as a key driver of action. When I talk about key driver of action, that's where you look at modeling and you start to realize that modeling tells you what is the likely impact of climate change, of the loss in biodiversity, of antimicrobial resistance to the health of individuals and to the health of population. That helps you that tells the government what is likely to happen if they refuse to act. And it's not just looking at health burden. Economic modeling is also a key driver of action because economic modeling tells you what is the cost of inaction and also the cost of action, because that's where you start to think about trade-offs, balancing trade-offs, which I will talk about in a bit. And when we start to think about government expenditure, and this is where I encourage you to think back to COVID-19, you realize that government need to spend. And how do we justify financing and the outcomes that is generated from the expenditure? This is again where modeling comes in to be very powerful as a driver of action. The second, of course, modeling tells you whether things are truly working and effective. That's where the classical narrative around monitoring and evaluation in global health comes in. Because modeling tells you around what works, what didn't, and also whether it is working at the cost per dollar value that you're getting, the cost effectiveness of it. The third is what I mentioned earlier on, really around modeling helps us to set trade-offs, to discuss priorities, and to find out trade-offs. And I will use the theme of PMAC this year, because this year is really around sustainability, climate action, biodiversity changes, and how all of this impact health. Now, if I ask all of you this question around the reduction in the use of plastics, plastic waste, or plastic bags, and do we even understand how much do we save in carbon credits if we reduce our personal use of plastic bags versus just not taking the car one day a week and taking public transportation? What is that trade-off? And I've done some background reading to try and find out what this trade-off is. And perhaps my search ability is not that great, but I couldn't actually find a very compelling reason to say that if I stop driving one day a week and take public transportation instead, actually it is equivalent to 400 plastic bags of carbon credits. Understanding this trade-off actually helped individual citizens like you and me make real life decisions around what we should be doing on a daily basis. This is where modeling comes in to tell you what the trade-offs would be. And finally, modeling is a very powerful tool to help with resource allocation. And we have seen again that with COVID-19, there was this massive, not just national scramble around identifying the health resources that's needed, but it was an international scramble. In Singapore, we were scrambling in the first few months over face masks. But do we truly need that amount of face masks? Do we truly need that amount of vaccine supply? Or are countries now faced with a different problem of expired vaccines that they have to throw away? So identifying what are the optimal level of health resourcing, whether it is manpower resourcing or whether it is consumable pharmaceutical resourcing, those sits at the heart of what modeling can help. So with that, I hope I have given a very simple introduction to what modeling can do in the face of a crisis, and I hope my fellow panelists will illustrate what I've said with real-life examples very much involved in what they have been involved in for the past few years of their lives. So with that, thank you very much again, and I shall hand it over to our co-host. Thank you.